topic is on nursing shortage and burnout. So a little bit of background is that nursing shortage and burnout is a major issue around the world, especially today. Increased workload results in decreased quality of nursing care. In 2013, there was a shortage of 7.2 million healthcare workers, and by 2035, the demand of nursing will reach 12.9 million. Examining the experiences of nurses working in this shortage may help to develop a greater awareness and aid in finding a solution to the problem. Although it is well known that there is a shortage around the world, there is little research about how this problem contributes to nurses' experiences with burnout. The identified problem is that there is a major issue with nursing shortage within healthcare, and this causes negative effects on nurses and their patients. Although there is little research conducted about nurses' experiences with working in the shortage. The purpose of this review is to examine nurses' experiences with the shortage and the effect that it has on nursing burnout and quality of care provided. Protocol guidelines for this review is that the inclusion and exclusion criteria includes research that must be conducted or translated to English, published from any country from within the last 5 years, and includes participants that are nurses of all ages from a variety of hospitals. Also, appraisal of selected studies was reviewed by the Critical Appraisal Skills Program. So for findings, after reviewing research on multiple studies about nurses' experiences, the overall consensus among the nurses was that they have negative emotions towards working understaffed. All articles identified that nurses felt they are specifically tired and burnt out, that there is management problems, and nurses feel stressed and overwhelmed in their work environments. Implication of these findings on nursing practice, education, and research are that since nurses feel stressed, they may make more mistakes at work, and most research is focused on negative experiences and not looking to fix the problem. With all of this being said, I have made some recommendations. 2 recommendations that may be used to aid in fixing the nursing shortage within nursing practice are to use an onboarding program and to offer altered schedules. Onboarding programs provide new employees to have an experienced nurse with them for the first few months of the job. This helps to obtain a smoother transition in the workplace. By doing this, new graduate nurses, such as myself, will feel more comfortable when transitioning into the workplace. This ultimately helps to create a well-organized, maintained, and effective workplace environment. This creates long-lasting positive impacts of the organization and will incentivize more individuals to work and enroll in the nursing program. Also, offering altered schedules to accommodate nurses is another strategy. Maintaining a good work-life balance is often difficult for nurses. Offering altered schedules such as mom shifts that can go from 9 a.m. to 2 p.m. and offering 8-hour shifts help to accommodate the unique needs of nurses. Implementing this will allow facilities to not have to lose workers because of problems with shift hours. More flexibility in shifts will allow for nurses to be happier with their work-life balance, promoting greater satisfaction and wellness. This may improve nurse recruitment and retention. And for education, recommendations are to implement a few educational days about the nursing shortage, offering professional support in schools, and to have informational days at high schools about nursing as a career option. I recommend that educational days are implemented within the workplace a few times a month. These educational days will include nurses who have experienced working in the shortage, and they will explain the prevalence and complications that the shortage has caused. They will also introduce de-stressing strategies. This will increase awareness and decrease prevalence of nurses quitting their jobs or taking time off because of problems associated with burnout. Another recommendation is to offer professional support providing network opportunities, academic support, and in-depth job previews. This could curb student dropout rates and create supportive work environments to lower workplace turnover rates. Also, having awareness of nursing as a career option for high school students can over time increase the number of applicants to nursing schools. And then for research, as previously discussed, there is little research about how this problem contributes to the nurses' experiences with burnout. Therefore, the recommendation I have is to examine more nurses' experiences specifically. This allows others to understand that the significance of the nursing shortage and what it does for nurses who are actually experiencing this firsthand. Providing more research on this topic allows for the problem to become more known and individuals to create more solutions. And that is it, but I just have a question for you guys, and it is, has anybody experienced working understaffed or has a family member who has? And how did it make you feel?